Could the COVID wave be nearing a peak already? Well, perhaps. The latest data from the Office for National Statistics suggests just over 2 million people were infected in the week ending the 10th of October. That's 1 in 30, and a rise of just over 15% on the week before. But there is a lag in this data, and other sources which are more up to date, though not as comprehensive, suggest the spread of the virus may be slowing. Remember the daily dashboard? Nowhere near as many people test these days, so it's no good for judging COVID rates, but it's useful for tracking the trend, and it does seem to be levelling off. That's backed up by figures from the UK Health Security Agency. Rates in hospital patients and staff are down to 11 in 100,000 from just under 14 the week before. It suggests rates are coming down in the wider community too. Now, if that trend is firmed up by more data in the next week or so, it will come as a relief for the NHS. But hospitals are still facing a serious surge of flu. Rates are up in every age group, according to the latest data, but there has been a particularly sharp rise in children aged between 5 and 14. It's now about 11%. And the UK Health Security Agency has warned of an increase in more severe illness in even younger children. These are hospitalisation rates, and they're up in every age group, but admissions are the highest by far in children aged 4 and under. It's the same story in intensive care units. Admissions are up across the board, but rates again are highest in children aged 4 and under. Doctors are urging parents to take up the offer of flu jabs for their children. So far, between 12 and 13% of 2- and 3-year-olds have been vaccinated, but that's well down on the same time last year. Normally, it's older adults who are most likely to develop serious flu, but younger children are unlikely to have any immunity to the virus because flu rates have been negligible during the COVID shutdowns. So what we're seeing could be another hangover from the pandemic.